Addiction isn't just a term from a textbook, it's a deeply personal struggle, something that I've lived through, seen my mum die from, and have helped hundreds of others overcome. Now in this video, I'm going to talk to you about what addiction is, different types of addiction, and some of the most common recovery options used to treat addiction. Now, after doing a degree in counselling and learning specifically about addiction and working as an addiction counsellor for the past 5 years and working in multiple rehabs in the past, I've gained a wealth of personal and professional experience on the topic of addiction that I'm going to share with you in this video. So what is addiction? Addiction is a chronic brain disorder, yes, but it's also deeply personal. It's about the compulsive behaviour we use to escape pain, even when that same behaviour hurts us more in the long run. I believe addiction is never just about the substance, it's about the root causes, the emotional pain, the trauma, the unmet needs. That's why over my career I've focused on helping clients through addiction counselling, because it allows me to go deeper and work on the underlying factors that are truly fueling addiction. Now, let's dive into understanding more about addiction, which typically is split into two categories, the medical and the psychological. Now, firstly is the medical perspective on addiction. Now, from the medical standpoint, addiction is viewed as a disease that affects the brain and impairs its normal functioning. It's much more than an inability to control one's substance abuse. The brain undergoes changes as a result of repeated addictive behaviour, leading to a heightened craving for the substance and a diminished ability to experience pleasure from other activities. Basically just messes with your whole brain reward mechanism. The second is the psychological aspect of addiction. In addition to the medical perspective, addiction is influenced by psychological factors. Individuals with addiction often struggle with underlying mental health issues such as anxiety, depression or trauma. These psychological aspects can fuel the cycle of addiction and make recovery more challenging. Ultimately, addiction is influenced by a complex interplay of the biological, psychological and social factors. But it's not just about science, it's stories. It's people who grew up in homes where drinking was normal, who turned to substances after trauma, or who felt overwhelmed by life and turned to drink or drugs instead. I see this every day in my practice. Clients come to me not just wanting to stop drinking or using, but desperate to understand why they started in the first place. So let's dive deeper into what causes addiction. So, what causes addiction? For me, losing my mum at a young age and trying to numb that pain was a big part of my story. Many of my clients share similar experiences, but there is a whole host of other factors, and we're going to talk about 5 of the most common. The first is trauma. Experiencing traumatic events can trigger a series of changes in the brain, leading to mental health issues such as post-traumatic stress disorder, PTSD, or anxiety or depression. Now, individuals might resort to risky behaviour, including substance abuse, as a coping mechanism to deal with the trauma they've experienced in their life. Number 2, co-occurring mental health disorders. The presence of mental health conditions, whether diagnosed or undiagnosed, can contribute to the development of addiction. These may include anxiety, depression, schizophrenia, bipolar, PTSD or OCD. And they can have a big impact on contributing to the cycle of addiction as a way to cope with the symptoms of these mental health conditions. Number 3, genetic factors. A family history of addiction can increase individuals' risk of developing similar issues. Like me, for example, my mum struggled with drink and I went on to follow in her footsteps with addiction, and that's the case for a lot of clients. Their parents may have drank heavily every day or a lot in their life. Number 4, environmental influences. The surroundings in which a person grows up in and lives in can significantly impact their mental health and vulnerability to addiction, particularly through exposure to addictive behaviour and substances or peer pressure or other social factors. And number 5 is strained relationships. Difficulties in personal relationships, whether with family or significant others, can lead to depression and engagement in risky behaviours, potentially leading to addiction. A lot of the clients that come and see me and join our program, one of the biggest things that leads them to reaching out for help is an argument or altercation with their partner. And that can be fueling their addiction, as well as obviously their addiction impacting their relationship too. The different types of addiction. So firstly, we're going to talk about alcohol abuse or alcoholism. Now, alcohol is one of the most commonly used substances worldwide, and excessive alcohol consumption can lead to addiction and have detrimental effects on people's physical health, relationships, and overall well-being. And furthermore, alcohol addiction can exacerbate existing mental health conditions like anxiety or depression. And long-term alcohol abuse can result in liver damage or cardiovascular problems or neurological damage and really impact your health. Substance abuse can also extend beyond alcohol and drugs to include other addictive behaviours such as gambling, shopping, or even excessive internet use. These behaviours can have a similar effect on the brain's reward system and can lead to compulsive habits that are difficult to break. So this leads us on to the next addiction we're going to talk about in this video, which is impulse addiction. Now, impulse addiction, also known as impulse control disorder, is a condition characterised by significant challenges in managing behaviour or emotions. This disorder encompasses a range of issues including pathological gambling, which involves an uncontrollable urge to gamble despite the negative consequences, kleptomania, characterised by a recurrent inability to resist stealing items that are not needed for personal use, intermittent explosive disorder, marked by a sudden episode of intense anger and violent behaviour that are disproportionate to the situation, and paromania, a compulsion to deliberately start fires to relieve tension or for personal gratification. These defining features of impulse addiction is the persistent struggle to resist the temptation to participate in actions or behaviours that are even harmful to oneself or that are carried out to harm other people, and that are just done in this recycled repetitive pattern to harm ourselves. Next, we're going to talk about treatment and recovery options to help you overcome addiction. Fortunately, there is hope for people struggling with addiction. Effective treatment encompasses a variety of strategies designed to meet the unique needs of each individual. These strategies include a range of tools for support such as behavioural therapies, medication support groups, residential programs, aiming to address both the psychological and physiological factors of addiction and equipped individuals with the recovery tools they need. So the first one we're going to talk about is detoxification. Now, a detox or detoxification involves safely eliminating addictive substances from the body under medical supervision while managing withdrawal symptoms to ensure patient safety and comfort. However, it's important to know that this is not a necessary step for most clients who are functioning professionals struggling with drinking or drugs. Most of the people we work with are not physically dependent on drink or drugs, so they don't need a detox. This means we can bypass this step and focus straight on the psychological side of addiction. So the next type of addiction treatment we're going to talk about is addiction counselling. A critical element of treatment, counselling helps address the underlying psychological aspects of addiction. Techniques such as cognitive behavioural therapy are common, aiming to modify negative thought patterns and behaviour patterns. Treatment may encompass individual, group, family or couples therapy, depending on the individual's needs. And this is what we specialise in at Leader Inside Addiction. All of our counsellors are trained to deliver addiction counselling. Next, we have rehabilitation or rehab. Rehab is a structured program designed to provide intensive support and tools for recovery. This can be done in a residential inpatient or outpatient setting, depending on the severity of the addiction and the individual circumstances. So for inpatient rehab, individuals live in a facility away from the stressors and the triggers while receiving 24/7 support. This is particularly beneficial for those with severe addictions or co-occurring disorders. Inpatient rehab often includes a combination of medical care, therapy sessions, group activities to promote holistic recovery. Inpatient rehab offers a focused environment with 24/7 care, and in my experience, this is not needed for most clients who are functioning professionals. Rehab is only needed for dependent drinkers who need a detox. Then there's outpatient rehab. This option allows individuals to receive treatment while continuing to live at home, and it's ideal for those with mild to moderate addictions who have a strong support system and a stable home environment. This is what our 8-week addiction counselling program is. It's an outpatient program that you can do at home while still living your normal life. The next type of addiction treatment we're going to talk about is 12-step programs. Now, these programs, such as AA, NA, they offer a structured approach primarily for alcohol and substance abuse recovery, promoting mutual support through group meetings and discussions about addiction and recovery paths. And it's often based on religion, which can, rightly so, put a lot of people off. I myself didn't get on with the whole higher power side of it, and for me, addiction counselling was much more effective. Next up is medication. Medication-assisted treatment can alleviate withdrawal symptoms, reduce cravings and treat co-occurring mental health issues like depression or anxiety. However, not all individuals in recovery will require medication, and it's most relevant for clients who are physically dependent on substances like alcohol or opiates. Now, if you're struggling with any form of addiction, whether that's drugs or alcohol or impulse addictions, then our team of trained addiction counsellors can help you get your life back on track. So to learn more about our step-by-step roadmap to get your drink or drug use under control, click the link below to watch the video and book your free assessment today.